cervical cancer. Tomo Kanda.
Good morning, everyone. My name is Tomo Kanda. I am an advisor on chronic diseases working for Pan American Health Organization based in Barbados. My responsibility is 10 Eastern Caribbean countries. First of all, I would like to express my sincere appreciation to Healthy Caribbean Coalition inviting me for this very important meeting. I have two reasons why I'm extremely happy. First of all, this is one of the few sub-regional meetings which completely focus on NGO civil society meeting. Normally when PAHO organizes a meeting, our main participants are government representatives. This is an extremely exciting moment for us in order to make a bridge between PAHO and also NGO civil society. Because after UN high-level meeting last year, in 2011, one of the key strategy is multi-sectoral approach. This is exactly the direction we are looking for. The second of all, I'm really happy to work with St. Maarten. As you know, PAHO, we have a country office in each representative office. And then, somehow, some of the country, Dutch territory and French territory are controlled by different country office. Particularly St. Maarten, half French side, half Dutch side. Do you know which country office PAHO control this St. Maarten? Which country office? Venezuela? Because you know that, right? I was going to give you an award. Yes, Venezuela is responsible for St. Maarten. And my office, we have two different parts. Half part of the office also responsible for French territories, which is half side of the St. Maarten. This is the reason why I couldn't work with St. Maarten until now, but this is an excellent opportunity for me. In my office, we have two technical advisors, one from Holland, Dutch, one from France, French. She said, Tomo, are you going to St. Maarten? I'm sure you like French side. And the other one said, I'm sure you like Dutch side. So in order to compromise both opinions, I was in Anguilla before, a week before. I came from Anguilla to here. I decided to take a ferry from Anguilla to French side and take a taxi from French to Dutch side. So now I can report to them which one is better. Anyway, I also want to congratulate the Healthy Caribbean Coalition because I remember last year, it was May in Jamaica, we had a sub-regional NGO civil society meeting. That meeting, based on the meeting outcomes, Healthy Caribbean Coalition developed a strategic plan for next 5 years. Believe it or not, when we have a declaration of Porto's declaration NCDs, which was 2007, one of the recommendations for the government was to develop NCD policy and plan of action. But the majority of countries still haven't developed this plan of action. They are working on this. But Healthy Caribbean Coalition, they developed plan of action last year, and now it's actually implementing. This is extremely, extremely unbelievable. So I really want to congratulate how NGO civil society act very quickly. So this is also a stimulating point for the government. So let me move on to my presentation. The title I was given was Cervical Cancer and Overview. But instead of giving just the data on the data, I want to highlight what PAHO can offer for you. My presentation will have 4 components. First of all, cervical cancer epidemiology in Latin America and the Caribbean, and why cervical cancer is such a high burden of diseases. What are the opportunities for the prevention, and also how Pan American Health Organization can support the countries. It might be a bit difficult to see the numbers. This is the cervical cancer in the world. Worldwide, each year, estimated 530,000 additional women worldwide each year, and leads to more than 275,000 deaths annually. If you see the number, well, Asian, of course, has more population, but our region, which is North America, Central America, Latin America, Caribbean, has the second largest number of the deaths due to cervical cancer. And 80% of these deaths occur in developing countries. If look at the mortality data in NCD, non-communicable diseases, more than 70% of NCD are in developing country and also country in transition from developing to middle income. Let's look at our region. In the region of America, the cervical cancer is most frequent cancer among female. These are the number deaths. If you look at the graph, the blue light blue grass, the bar indicate age standardized incident rate, and the deep blue indicate age standardized mortality data rate. Caribbean is one of the highest among whole sub-regional in this America. Cervical cancer highlights the existing inequities in wealth, gender, and access to health services. Remember, this region of the America has highest inequity in terms of access to the health and the economic status. Look at the Caribbean region. Again, even the Caribbean, the cervical cancer is first most frequent cancer among women, especially aged between 15 and 44 years age. This is a data 2008. Okay. The blue lights indicates the numbers of deaths under 65 years old, which is premature deaths, and then green indicates over 65. If we continue these trends, then we project by 2013, the total number of deaths will reach 3,500 in this only Caribbean region, only cervical cancer. Cervical cancer mortality, again, Caribbean region is the highest, and if you look at the country by country, the red color has the highest, which is this country. Could you tell what is this country? Paraguay, Bolivia, and also Peru. And then Ecuador comes next, and Costa Rica, and then Suriname, so on. Cervical cancer in the Caribbean. I pick up several country incidence rate and mortality. Haiti has the highest, 64.7, and the mortality is 48.1. Jamaica comes next, Trinidad and Tobago, Barbados, and Bahamas, and Puerto Rico. HPV prevalence in selected country in this region, Honduras has the highest, and Trinidad and Tobago comes next, and Guatemala, and they go down. This is a trend. HPV genotype in Latin American countries and the Caribbean, we see more at type 16 and 18s. HPV prevalence in the Caribbean, we just pick up only Cuba and Jamaica because data are available. And cervical cancer in Cuba, number of tested 45 cases and 98% HPV prevalence. And Jamaica, it has a different stages, normal, low-grade lesion, and high-grade, and cervical cancer. So these are the data. Again, one of the problems in the Caribbean are still we are missing information data. This is the reason sometimes we cannot really advance the program. But again, this is a great opportunity. We can conduct together with NGO and the government situation analysis first. Then we will think about the best strategy for the Caribbeans. Now, why such a huge burden of diseases, cervical cancers? Most of you know about the health services in the Caribbean, particularly Eastern Caribbean countries. Primary health care is the first platform to provide health services. But there are several problems, which is program organization, because limited human resources doesn't allow to provide the various services. And also screening technology and human resources, budget resources, there is not enough sufficient laboratory testing. So when the people go to the primary health care for the examination, first of all, there is not much enough technology available. If there is any, such as private setting or hospital, by the time they send out the specimen to the laboratory, sometimes country doesn't have a laboratory system, they have to send out to the outside of the country. And when when they receive the result, the patient, they already lose the tracking follow-up system with the patient. This is another reason. And the factors associated with the woman. And one of the strongest the health services in primary healthcare in the Caribbean is probably a vaccination, immunization program, family and community health. And especially vaccination is strong, especially communicable disease-oriented vaccination, but not for the cervical cancers. And also, we have to best utilize existing health services because health professionals are limited and people cannot come over and over. So when the people come to the health center for the vaccination or anteneonatal and postneonatal treatment, and we have to combine those services, integrated approach is very important. Opportunities for improved cervical cancer prevention program. First of all, PAHO is trying to introduce and encourage country HPV vaccinations. And also there are some new screening tests which is cost effective, such as HPV DNA test and VIA, visual inspection with acetic acid. Some of the data indicate combination of HPV DNA test and also VIA perform equal to or better than pap smear examination test. The screening test and also treatment approach. As I said, once we screen and diagnose, we have to keep tracking in order to not lose right moment for treatment. This is also very important. VIA, just follow after, followed by cryotherapy treatment is also one of the opportunities. WHO recommendation, HPV vaccinations. We try to encourage the country routine HPV vaccine in as part of the national immunization program if cervical cancer prevention is a priority for the country. And if it is feasible, and this is also an important point, sustainable financing can be secured. It's costly, but in somehow country have to find how they can secure the cost for the HPV vaccine. There are several ways to secure. For example, the majority of countries are working on tobacco control, FCTC, Framework Convention tobacco. Maybe some of the tobacco tax revenue will support vaccination, or maybe we can stimulate in the private industry and private company to donate some of the vaccination at the cost. So countries have to invent their own way. And also cost effectiveness is considered. Priority population, we recommend girls aged between 9 to 13 years, and also catch-up strategy, adolescents and young women. Believe it or not, Caribbean region, particularly Eastern Caribbean region, the first sexual debut is much earlier than we think. Therefore, one of the global school health survey indicated first intercourse experience in some countries is much younger than 13 years old. So what PAHO, Pan-American Health Organization, will provide technical support for the country? There is a regional strategy and a plan of action adopted by Direct Counseling 2008. There are 7 the line of action. First of all, we must conduct situation analysis, assessment. This is the reason before we have this workshop, together with Pan-American Health Organization and Healthy Caribbean Coalition, we requested the participants and also country to complete questionnaire, which is called Cervical Cancer National Capacity Assessment Questionnaire. Some countries submitted, but some countries not. But first of all, before we start any kind of program, we must know what is the situation analysis current status. This is very important. Then we have to intensify information. Education is also important. Not only single HPV vaccine can substitute for everything. No, we have to approach whole the package. Fortify screening and pre-cancer treatment program. After the early screening, the proper diagnosis have to be made, and we have to provide pre-cancer treatment program. And establish or strengthen information system and cancer registries. When we speak Eastern Caribbean countries, only Barbados has cancer registry. Rest of the country have chronic disease registry as well as cancer registry. So what PAHO is trying to support the country is, instead of supporting country by using different methodology, we want to support all the countries at the same standardized way of development of cancer registry. We are currently working on this. Improve access and quality of cancer treatment and palliative care. And again, the country has a very limited resources and facilities. Sometimes patients have to go to the outside of island for the further specific treatment. Once patients are outside of the country, there is nowhere to track, just because health information system is not very strongly established yet. So this is another way we have to support the country as well. Generate evidence to facilitate decision making regarding HPV vaccine introduction. Again, there is not many countries have developed cancer policy and plan of action in the country. What PAHO can support the country is based on the evidence. We have to support the country to develop effective policy and plan of action. Advocate is also very important. This is exactly the part which Healthy Caribbean Coalition and also all the participants here can really contribute. Advocate for cervical cancer prevention and control. As Professor Hasso mentioned earlier, it is preventable, but the majority of people do not know the impact of the cervical cancer and how they can prevent. The advocate and public education is very important. So time is up, so I will skip these 3 slides. I think the presenter, doctor, he will address this specific information about HPV specific testing. So I will skip these 2. These slides are supposed to be the country has resources and the country doesn't have resources, what sort of step have to be taken. So this is the whole map, implementation, current implementation of the regional strategy. So if you see the whole our region of the America, VIA test has been implemented, Guyana and Suriname, and pap smear and HPV DNA testing combination is Argentina, only Argentina. And PAP and the VIA combination will be is implemented in Peru and also Ecuador and Costa Rica and some of the Central America, and pap smear and Brazil. These are the current situation. Again, we need more information, current situation analysis of the Caribbean in order to provide effective the support. Okay, so I will almost finish. The key message is, especially for the people here, advocacy for public education through multi-sector approach is very important. And then maybe we will discuss different issues, many issues for next over 2 days. From PAHO, if possible, we want to hear what you would like to ask PAHO to support. Because we are planning to prepare some grant. We identify some potential donor to support cervical cancer activity in the Caribbean. So after this meeting, we want to have some recommendation, feedback from all of you, and we want to develop special project proposal to support a cervical cancer activity in the Caribbean. Thank you very much.